I'm Dr. Jen Kanakry. I'm the medical director of the Stem Cell Transplant and Cellular Immunotherapy program at MedStar Georgetown University Hospital. We treat patients with blood cancers and other diseases that require cellular therapy, meaning cells to help either correct their underlying disease or cure their blood cancer. And those cell therapies can be auto transplant, allogeneic transplant, or CAR T cells. Patients come to us with the question of, why am I here to get cell therapy? And it is a very unfamiliar territory for them. They've often been to their hematologist or oncologist getting chemotherapy or other treatments for their blood cancer, and then they arrive to our clinic to get cell therapy, and we explain to them the role of cell therapy for their blood cancer. My philosophy of care is to really involve the patient the entire way and let them lead the way in helping us find the right path and the right therapy for them. Granted, I know that they don't know the therapies, and so I provide the education and the discussion and lay out the options and what that would look like, but really want to hear from the patient what they're seeking in their care, and together help guide them through what is really complex. Cell therapy is a really complex thing. It's a huge endeavor and investment for the patient and for the treating team, and we have to do that working closely together. I think one of the most interesting things about cell therapy is that it's giving a living medicine. It's not chemotherapy or other drugs or radiation. It is literally living cells that go into the patient's body with the ability to attack and respond and change themselves and hopefully do things that other medicines cannot do, literally living inside the patient to carry them forward, hopefully with disease control. What I love about my job is that we can give a cutting-edge therapy to patients with really serious diseases, leukemias and lymphomas, and provide them with a chance of cure. And that is something that has always attracted me to the field of cell therapy, because it can give hope to patients who have faced major medical problems and often a lot of therapies that haven't worked, and they come to our clinic and we can say, now let's try cell therapy and see if we can finally get you through this major medical problem of facing a leukemia or lymphoma. The Stem Cell Transplant and Cellular Immunotherapy program is a FACT-accredited program. We offer cell therapies, including autologous stem cell transplant, allogeneic hematopoietic stem cell transplant, and CAR T cell therapies to patients with blood cancers like leukemias and lymphomas and multiple myeloma. And this provides a potential cure or period of really good control of their cancer that can be beyond what other therapies can provide. We are the only FACT-accredited program in the area, and FACT accreditation means that there is an external body looking at our outcomes and our process, making sure that we have staff educated in a high-quality way, that our patient care is top-notch, that we're delivering a quality service on every level, from the facilities to the way we decide on cell therapies to the quality of the cell product from start to finish. So it's really a stamp of approval that we're doing cell therapy at the highest level possible. Many patients will find themselves referred for cell therapy as the next step in the treatment of their blood cancer when they've previously been given chemotherapy or radiation therapy. or antibody therapy. And then it reaches a point where we feel that medicines and chemotherapy will not get rid of or control their blood cancer, and we turn to the immune system. And cell therapy is using the immune system to try to attack and kill someone's blood cancer. And the newer ways of doing this is CAR T-cell therapy, which many people have heard about on the news. It's been a major advance in the field of leukemia and lymphoma. But back even 50 years ago, the first immunologic cure using the immune system to cure cancer was transplant. And so building out of that was this idea that the immune system can be a powerful cure for cancer. There are three main types of cell therapies for blood cancer. There's autologous stem cell transplant, which allows us to give very high doses of chemotherapy to patients and then rescue their blood-making capacity with their own stem cells. And we would not be able to give that amount of chemotherapy without the rescue cells. There is also allogeneic cell transplant, where we find a healthy donor and use that donor's immune system through transplant to attack and kill their blood cancer. And then finally, the newest therapy that we offer is CAR T-cell therapy, where we take and collect T cells from the patient. They're grown up and trained to target the patient's cancer, leukemia, or myeloma, and given back to hopefully really bring a deep remission for the patient. CAR T-cell therapy is used in patients who have lymphoma, acute lymphoblastic leukemia, and multiple myeloma. So we now have multiple different CAR T targets for multiple different types of blood cancers. CAR T-cell therapy requires first collection of T cells from the patient through a machine collection procedure, and then we send those collected cells off to the company that manufactures or grows up the T cells, training them against targets on the patient's lymphoma or multiple myeloma. And then after some preparation to knock down the patient's immune system with some chemotherapy, we give those manufactured T cells back, trained and ready to attack and kill the lymphoma or myeloma cells. CAR T-cell therapy, like all cell therapy, is a process of multiple steps of preparing the patient with chemotherapy to knock down the immune system, to get ready to give space for those cells and that new immune CAR T-cell to grow up. And so we use chemotherapy followed by giving the cells. It's a little anticlimactic getting the cells, actually. It's just a little syringe of cells or a small bag on the IV pole, so it maybe seems like nothing, but then the work starts, where inside the body, after the patient has been prepared, we hope that those cells, the amount that we've given, grow and multiply and find the lymphoma or the myeloma and attack and kill them. And so the process really is watching those cells grow up, looking for side effects and following the patient very closely, but hoping that those cells grow up over time and do their job to attack the cancer. After CAR T therapy, we have to watch patients very closely with a lot of close follow-up in clinic, because we do know that there are side effects of having a bunch of CAR T cells grow up inside someone's body. They can cause some inflammation and fevers and other side effects that we do monitor for closely. And we have medicines to dampen down some of those side effects if they start to occur. Everything in cell therapy takes time. It's not an instant change that happens. It happens over a period of weeks where we hope to see more and more CAR T cells in the blood of the patient, knowing that they're going to work against the blood cancer. And then with time, we do look to see if we can see signs of the myeloma or lymphoma in the patient through the routine scans that these patients are used to of getting imaging, PET scans, CT scans, and other studies to look for their disease. At Georgetown Lombardi Comprehensive Cancer Center, we not only offer standard of care cell therapies, but also have many active clinical trials so patients can get access to hopefully what is an even better approach to treating their cancer. And we have cell therapy trials, we have other trials that stimulate the immune system to try to fight blood cancers better. Cell therapy is really the current and next frontier of cancer therapy and has really changed the outcomes for patients with blood cancers. And very exciting is the current CAR Ts that are out there, but hopefully there are many more to come with different targets or multiple targets, so that as the blood cancers get smarter, we get smarter right along with them and provide more attack against the growth of the cancer. But even beyond that, allogeneic transplant has been around a very long time for the treatment of blood cancers, and as the only potential cure for many blood cancers. And the advances in the field over the last 20 years and even in more recent time really have changed allogeneic transplant, where now we should be able to offer an allogeneic transplant to any patient that needs one, even if they're older or don't have great organ function, even if they don't have a perfectly matched donor. And these are key areas where we have broken down some of the historical barriers to cell therapy and truly should be able to offer it to any patient who needs it. Going through cell therapy requires a multidisciplinary team where it is not just the cell therapy doctors and nurses and advanced practice providers, but it is an entire team of people working together to deliver the best possible care. That includes clinical pharmacy specialists, dietitians, physical therapy, palliative care to help control pain and other symptoms, a whole host of people working together, as well as consultants. And the wonderful thing here at MedStar Georgetown University Hospital is that we have all of those services right in the same location, where patients can get top-notch subspecialty care, get their cell therapy, but get all of the supportive expertise, care that is required to successfully go through such therapies. The stem cell transplant care team is a group of providers who are present on the inpatient and outpatient front on a daily basis, moving patients from their outpatient preparation for cell therapy, supporting them inpatient while they're getting their cell therapy, and then successfully moving them back to the clinic. And this involves a large team of transplant physicians, as well as advanced practice providers and nurses, coordinators, schedulers, everyone working together to help the patient through their complex cell therapy care. Patients should choose MedStar Georgetown University Hospital because we offer all of the available cell therapies to treat blood cancers. We have expertise in acute leukemias and the diseases that require a quick pathway to cell therapy. We have experts in lymphoma and multiple myeloma, so that from diagnosis to hopefully long-term remission and even cure, patients can be cared for here, first with a knowledgeable hematologist oncologist for their primary disease, and then through a cell therapist for the last steps of their care.